So every proposed agenda item must have a one-page summary of the topic submitted to mcpab@utah.gov no later than 7 days prior to the board meeting. Board members will present the one-page summary during board meetings, and board members will discuss the summary. If no written summary is provided to board staff, the relevant agenda item will be removed from the agenda. Only items that have been submitted in writing in advance of board meetings will be allowed during discussion by the board chair, including presentations from the public. Board members will then request additional presentation and memorandums on those agenda items from relevant bodies to be presented at the next board meeting. Those presentations and memos will also need to be submitted at mcpab@utah.gov 7 days prior to the board meeting. Public comment instructions. Public comments will be limited to 2 minutes per person. If you want more time, you must request it from the chair. The chair may accept or reject requests for additional time. A public comment period is not guaranteed every meeting. The chair has the authority to create or remove public comment period from the agenda or during the meeting. You can look over public comment guidelines that are posted on the Utah Public Notice website. Please state your name and your affiliation when making a public comment so it can be reflected in the meeting minutes. Only comments made on items on the agenda will be considered. If you have comment about an item not listed on the agenda, please email them to mcpab@utah.gov. In making a comment over Zoom, the Zoom public chat will be disabled during the Zoom meeting. When the chair indicates it is time for public comments, you will use the raise hand icon on Zoom to indicate that you would like to make a comment. When you are called on, you will be taken off mute. Take 2 minutes to make your comment. All right. When making a comment in person, sign in on the public comment sign-in sheet with your name and indicate what agenda item you want to make a comment on. The chair will indicate when it is time for the public comment period. The board chair will call on you when it is your turn, and you will come to the public comment table. Take 2 minutes to make your comment. As a reminder, if you're in person, please do not speak when others are presenting. Our mics are very sensitive, and those attending over Zoom cannot hear when there is more than one person talking at a time. Side conversations and comments from the public during this board meeting are prohibited. Please use a voice that is louder than your typical one when speaking, commenting, or presenting. When you speak, please lean towards the table as if there were a microphone. And for additional information, to make a suggestion for agenda items or to contact board members or staff, please send an email to mcpab@utah.gov. I want to welcome everyone today on October 15th, one of our, second to last day until we get some snow. So, yeah, it's here. So, we'll go through, just on the next item is the approval of minutes. Did everyone have a chance to look through the minutes? Any changes or amendings you want to make? If not, we'll go ahead and just do a voice vote. All right. Yeah. All in favor of approving the minutes? Oh, do we need a motion?
I'd move to approve. I'll second it.
All right. Thank you for those motions. And then all those in favor of approving the minutes, say aye.
Aye.
Aye. All right, it's been approved. All right, we do have some business. I do appreciate everyone's flexibility in accommodating this change in this meeting. As the legislative session is picking up, there's some overlap between our meeting and the working governance group. And so we tried to make some modifications in order for those that are interested in attending that meeting as well, can have a sufficient amount of time to get to that meeting. I don't foresee anything, at least for the rest of this year, conflicting. So is everyone good with continuing with the 2 p.m. start time? And then when I go back, okay, we will continue with that for the next meeting in November. All right, and then going forward, we will go ahead and move on to item number 4. We'll turn some time over to Mr. Oborn for some DHHS update. Rich.
Great. Good afternoon, everyone. Just a few general statistics that reflect growth in the program. We have now 89,505 active medical cannabis cards as of September 30th. And 958 qualified medical providers registered in the program and 75 pharmacy medical providers or pharmacists registered in the program. Also, we had our first cannabis medical provider quarterly meeting virtually. It was held on October 10th, and it went well. We were able to provide medical providers updates regarding the electronic verification system that's new on the Salesforce platform. And so we walked through some keys to using that effectively. And then also we provided them some training on some of the laws related to practice as a medical provider, and got some great questions and comments during that. We got some good feedback that was helpful. So although these meetings that we hold with them aren't public, we do post the minutes of those meetings on our website within 1 week. So we'll be posting those soon. And that way medical providers or employees of clinics that are curious about what topics came up and that they can get all that information off our website. And like I said, we'll be holding that meeting quarterly. So over time, medical providers can choose to join that or send their staff to join it and then share information with the clinics as they get that information. So we're glad to be able to do that for the first time. And then next week, we'll be at the Utah Fall Conference on Substance Use. That's on next weekend. We'll be there Thursday, October 24th, and we'll be presenting on strategies for safe use of medical cannabis. And I'll be presenting with Dr. Matt McKiff. And many of you know Matt. He is a former chair of the Cannabis Research Review Board, and also someone we contract with to help us do presentations. So we're looking forward to that presentation. Also, the Cannabis Research Review Board met recently, and they approved the medical cannabis patient assessment checklist that we hope medical providers will use as a resource. That's been posted on our website, and we'll be deciding internally how to make sure that's distributed and brought to the attention of medical providers. But it was just approved last week, and we got it posted on our website over the weekend. And so we were excited to work with the Research Review Board on that resource. Also, the Cannabis Research Review Board made updates to treatment guidelines for PTSD, also for persistent and debilitating muscle spasms, and the HIV/AIDS document. Those are separate documents that they approved amendments and updates to be made based on new research that's out there on those topics. So we enjoyed working with them on that, and excited to have those documents updated over time as new evidence becomes available. And then later today is the Medical Cannabis Governance Structure Working Group meeting. DHHS is presenting on standards for medical provider patient education. And then also we'll be discussing some challenges with accessing medical cannabis in long-term care facilities with that working group. Are there any questions about any updates that I provided?
Okay. Thank you very much. Turn the time over to Dr. Forsyth.
All right, we have a couple of updates. So we recently spoke with the Department of Finance with the state of Utah, and according to statute, they're responsible for approving the payment processors for the medical cannabis pharmacies. And they're concerned that they're not really adding value there, and they're not sure what their role is really supposed to be. So they want to come present to the board at the next meeting if possible, take a little bit of time and learn what their responsibility would be, how they can add value and protect patients in the state. And if what they can do is get out of the way, that's also an option that we can ask the legislature for before this next session. But we would do especially like information from patients or from the licensees about how they can be better supported by the Department of Finance in doing their role. Additionally, we have the ICS getting ready for rollout. It's been delayed a few times, but we're hoping now that we have a firm date for the launch on the 28th. There are still concerns, obviously. It's a big system, and the data migration is a big concern for us right now. The companies would like a blackout period for the system to be able to make sure that everything's in sync between the two. We're pushing back a little bit on that to try to get that blackout period to be as minimal as possible, because we don't want to disrupt patients' access to medicine or the company's ability to operate. So we'll have more details hopefully in the near future for you, but we're planning for a go live towards the end of this month. There will be an update from Tony coming out toward all the processors, all the licensees, either later today or tomorrow.
That's just on the supply side of the business, right? Cultivation and processing, or is this going live for pharmacies?
So that you will also.
That you'll be doing as well?
How long of blackout are they thinking they need?
They were discussing timetables of like a week, and I told them
Oh,
that's
wow.
really unacceptable. So
Down 15 minutes.
that's how I would like it to be. And we're definitely going to push towards that direction.
Okay.
But it's a lot of data and a lot of stuff to get in sync. So it's understandable that there needs to be some kind of blackout period, but we do want to minimize impact to the industry.
Will they do it on a weekend? Could they do it over a weekend? I
Well,
mean, I'm
a
sure
lot
this
of
has
them
all been
are
thought.
open, like weekends are actually fairly busy for pharmacies as far as I know, so.
Yeah.
That might
Maybe
actually be
Sunday.
worse than on a weekday.
But not Sundays.
And the
No.
blackout for the
Open
EDS.
These are all open Sundays.
Yeah,
Are they all?
Mondays are typically,
so feedback
Mine
from
is
industry
slowest.
would very much be appreciated there.
Yeah.
We really do want to minimize impact here.
well,
I mean, I can, long story short, there is no debate.
there's not.
No, there's not much.
Just pick one and.
To do it right,
But I don't want to we don't want to close you guys down on the busiest day of the week. And
Well, we also-
patients are expecting to come in and get there.
Are you expecting the migration to last? Like, is this just a flip and it's instant, or is it gonna be take several hours that you wanna shut down and like, it's gonna take overnight to do?
So the problem is the data load.
Yeah.
And so we'll be loading the historical data into the system. We're already working on that. But you have to do a delta load and potentially multiple delta loads right before the go live. And that's where things have to come to a halt so that you can get all the current data up into the system.
Yeah.
There's also, just because there is a lot of pressure on this go live, we're going to have dual entry be required for the first couple of days probably, just so that there is a failure in the new system, we can still stay online with MJ Freeway. We don't want there to be a situation where the patients don't have access to medicine for any extended amount of time.
Can we get a warning so we can like put it on Instagram
Yeah.
or whatever, so everybody can be aware and.
When after that email comes out, we're still waiting for some signatures on the change order, so that's why I'm not announcing official dates right now, but they'll be out shortly.
I mean, the best would be doing it during a time when pharmacies are closed, so overnight.
Yeah.
Would be the best time to do it, and trying to have that last upload be before anyone starts doing business, in the morning, but, for us. Orders start to go out, with home delivery, early in the morning too, so, yeah, I think overnight would probably be best.
Yeah, I'm hoping we can talk them down to like a 12-hour period or something like that, but
Sounds good.
they're asking for more like a week, which is obviously not acceptable. I think we can all agree.
I mean, unless you want to trust us to just dispense medication. Yeah.
Yeah, that could
A 1
be
week amnesty.
just a 1 week
Yeah.
With the
amnesty.
legislature.
I'll ask him today.
Yeah.
Friday.
Yeah.
Literally.
All right. Oh, yeah, so last month I missed this meeting as I was up there talking with the EAC executive team up there. Because they changed some plans on us last minute, but ultimately we weren't able to get on the regular EAC meeting agenda. And so we're hoping to make it on that meeting agenda for the next month for all those that are interested in attending and talking about the additional pharmacies opening up in Utah. And that's it. Any questions?
No question, sorry. Would it be possible to speak up a little bit more?
Oh, yeah,
It's very conversational, it's our TV here in country.
sorry. I'm speaking that way.
Hey, Matt, if I could just
Oh, yeah.
update the Dr. Forsyth misses. We do have 2 rules that went into effect since the last time we met there, the R66-2, the processing rule, as well as R66-3, the quality assurance testing on cannabis, just recently became effective. And just a quick add-on to Dr. Forsyth's mention of Division of Finance, we'll be sending out an email to the industry, just to get some input and some feedback, and so have an explanation, we all get some answers back.
Cody, what was the effective date for those rules? Because when I looked at the website earlier, it's today's the effective date. Okay, that's why when I looked the other day, they weren't effective yet.
I looked this morning too, so I asked.
Sounds good. Okay. All right, thank you very much. We will go ahead and move on to our next item. We do have a training for us board members. And those of the public that would like to be trained as well can listen in. Turn the time over to Ms. Meters.
Hello, everybody. I'm trying to speak up. I've been told my third time voice. So we'll see. So this is your annual training for the Open and Public Meetings Act. It's a sunshine law. It, along with grandma, is designed for the public business to be done in public. So the Open and Public Meetings Act, or law, is in Utah Code Title 52, Chapter 4. So an applies to meeting of public bodies, and both those terms are defined in the act. And so whether or not the act applies depends on the definitions. So I like to break it up into three sections: before the meeting, during the meeting, and after the meeting. So before the meeting, you have to post notice of the meeting and the agenda, letting people know the date, time, and place of the meeting, and what will be on the agenda. So what the public body will discuss or vote on at least 24 hours before the meeting. Notice may be posted less than 24 hours in advance if an exception applies. So there's exceptions for emergency meetings in 52-4-202. Those don't apply, then you have to at least post notice 24 hours in advance. Also before the meeting, do not act together as a quorum outside a meeting to predetermine an action to be taken at the meeting. So don't get together and say that this is how we're gonna vote. And also before the meeting, a meeting may be held electronically if the public body has adopted procedures to govern electronic meetings. So Department of Health and Human Services has a electronic meetings rule in R 380-2. And the body has to provide an anchor location for the public. That kind of changes last legislative session. So I'll get to that. Electronic meeting may be held without an anchor location if the chair determines that having an anchor location presents a substantial risk to the health or safety of those who will be present, and the chair follows the appropriate protocol. So that changed during COVID. An electronic meeting may also be held without an anchor location if all members of the public body attend electronically, unless the public body receives a written request for an anchor location at least 12 hours before the meeting. But that's what changed this last legislative session. So during the meeting, must be recorded and minutes taken, unless it's a site visit or traveling tour where no vote or action is taken. You can only act on items on the agenda. So if a member of the public or of the public body brings up an issue that's not on the agenda, you can discuss it, but you can't act on it or vote on it. It needs to be put on the agenda for the next meeting if you still want to talk about it. Do not message or text each other during the meetings about board business. The public tends to not look kindly on if board members are texting each other because they don't know what you're texting. It could be personal, it could be nothing, but it could be about the board business and it looks suspect. You can only close a meeting for a purpose listed in 52-4-205, and that must be voted for by 2/3 of those present. I don't think most of what this board does would ever apply, but if you want to make sure you get counsel about that, whether or not the rules apply for closed meetings. And then after the meeting, post recording of the meeting, approve minutes and any public materials distributed at the meeting within 3 business days, and then make the draft minutes available to the public 30 days. So from the prelude to this meeting, it sounds like you're doing everything correct. The penalties, so an action taken in violation of the open meetings provision is voidable by a court. So if somebody comes and says you took an action, but you didn't follow the OPMA protocols, a court can say, well, that action is void, you have to go back and do it again. So you'd have to go through the process again, post it on the agenda, go through the public meeting, take votes and all of that. If you knowingly or intentionally violate the closed meeting permissions, it's a Class D misdemeanor. So that's a much more serious penalty, and you want to make sure that if you're closing a meeting, you know what you're doing. And of course, yeah. So Last legislative session, HB 36 changed some things, changed definitions of anchor location for electronic meeting and meetings. It also repealed some language relating to posting a written notice of electronic meeting. It also removed the requirement that all non-unanimous votes taken during electronic meeting be taken by roll call. And also changed the requirements for anchor locations as I discussed above. So you can have a solely electronic meeting, with no anchor location, unless somebody from the public says that they want to attend, then you have to have an anchor location. And also that needs to be in your rules or bylaws in advance. So I don't believe DHHS's R380 actually addresses that, so that might be. It looks like people like to be here in person anyway, so maybe that's not an issue for you. If there are any questions, you can email me at crmeters@utah.gov, or you can ask them right now. Do you have any questions?
Thank you very much.
Thank you.
Great.
Yeah.
We will go now on to our next item, UDF draft rule R66-N, closed door pharmacy, and we'll turn time over to Dr. Forsyth and Mr. James.
Right, so, as the board knows, that the last legislative session, there was a statute change allowing what they're calling closed door medical cannabis pharmacies, which, to maybe simply put it, is just kind of is a hub for, medical cannabis delivery pharmacies to be able to set up somewhere else in the state and maybe to shorten that distance for delivery. So the department was told to make some rules on that, so this is what we have presented. I will say that after I sent the draft out, I noticed that I missed some letters, so I changed those. I just didn't send them to you guys, so I did catch those couple letters on that. But overall, just in to keep in mind the time and not necessarily showing word for word on these rules. The overall look at this rule is pretty much the same as what it is for pharmacies, kind of holding the PICs to the same standard. A lot of security stuff based on what it is. Obviously, there's not going to be visitors there, or patients, I should say. There could be some visitors, but mostly not going to be any patients there because it's supposed to really be a delivery hub. Probably the things to really take a look at on this rule would be under R66-10-3, which is the licensing portion of it. Kind of speaks about a little bit of detail as to what the department will be looking for in the application, and when it comes time to decide who should get certain licenses. There are some requirements in the statute that says only so many of them can be in a county of class 1 or class 2. And for the next couple of years. So that's really what these are going to be, right? The hope is maybe if it's something that's needed, that there'll be a couple of these spread throughout the state, makes things a little bit easier for patients, hopefully. But again, number 3, or sorry, -3, 10-3 is probably something to look at as far as the licensing aspect goes. Operating plans, it's pretty much just going to be in addition to a delivery pharmacies operating plan. They're just going to have to add some information, obviously, on how they're going to get product to the closed door pharmacy, as well as handle things there at the closed door pharmacy, well, which is part of 10-5. The next thing to kind of take a look at more in depth would be 10-7. The lawmakers did make it clear that they wanted the ability to have a closed door medical cannabis pharmacy at a processor. Have those in the same facility, but to make sure that we do keep those separate as best as can. So 10-7 is those regulations. We're trying to keep a closed door, the medical cannabis pharmacy and the medical cannabis processor separate, so they can't mix any materials or products at that time. Security standards are going to be very similar, as well as inventory. We're at least at this point expecting that inventory is going to be obviously a lot lower, because it's usually going to be just stuff that's going to be ordered more often. Not to have 70,000 SKUs on hand at any given time. They're probably going to be a lot less than that. At least that's our initial thought. If you guys have any different ideas about that as it goes on, please let us know. The handling and storage of that, obviously, just we want to make sure that the product is being kept safely and sanitary. To make sure that the product stays in good condition. Transportation is pretty much the same thing, coming from other pharmacies, as well as anything going or coming from, I should say, processors. Disposal and waste, what we said is really that we're expecting that to either go back to the original pharmacy or go on to, depending on what the operating plan says, but be able to go back to a processor for destruction if need be. Again, obviously, that's something that gets talked about amongst you guys a lot and have that in your operating plans for destruction there. We did put something about product recalls in there. Other than that, the partial filling and change in operating plans are gonna be the same as what's already happening with other licenses. And then last, two things to maybe look at is, 10-16, which is revenue reporting. There is a portion of the statute that says any, delivery pharmacy that opens a closed door medical pharmacy, it can only have a certain percentage, so makes a certain percentage of what the overall pharmacies are making, or has an amount listed in, I apologize, I was gonna write those down and didn't. But that's something that is going to have to be shared with the department in certain ways for us to be able to maintain that that's being met regulatory wise there, so there's some revenue reporting. And then lastly, something to take a look at is 10-17, closed door pharmacy license renewals. Because these licenses are actually attached to a delivery pharmacy, as we go forward there, what we would do is have that expiration date happen at the same time as the delivery pharmacy. Rest of that violation category is something we see in all of our rules as well. But like I said, for the most part, going to be very similar to our already existing rules for pharmacies with a couple of those additions and changes and more things to be based on it being a closed door pharmacy. But happy to try and answer any questions. And like I said, there'll obviously be time for public comment as we put it out there, but we want to get this supposed to be in right as we can the first time, so we can get this done. As quickly as possible.
I do have a couple questions. You referenced multiple times in there, that this is can you explain to me the difference between a home delivery medical cannabis pharmacy and a medical pharmacy?
No, that's a word salad for me. I haven't got, even when I started writing the rules.
Is it in statute that's labeled as a home delivery medical cannabis?
Which one, where are you looking at?
Just on R66 10-3, right at the beginning.
And we tried really hard to use the same wording in statute, so it could be wrong, but I don't.
Well, it's just, I mean, there's times you call it just a medical cannabis pharmacy, and then other times it's a
Yeah,
home
we'll probably
delivery.
need to correct
I
that.
just don't know what the difference, like, so if it's not, maybe just strike that, because I
One
think,
can do delivery, one cannot.
but
You
even,
pay different licensing fees.
but,
Okay,
and-
I
Yeah, so
just-
your home delivery is correct.
but can't a pharmacy have delivery without doing home delivery? Like, they can have a courier come pick it up?
I think they still have to be a home delivery medical pharmacy. They just use a third party to do the deliveries.
So they're still paying that
So they
5,000
are, yeah, so they are.
on
getting
top of it, just not to, okay.
No.
No, yeah, you're good. I mean, I'm sure I've read it like that. The other thing on there is I'm not seeing in here, I thought it was thrown in maybe in this new rule change that just went into effect, the ability for a pharmacy to decline a delivery or reject a delivery on inventory.
Well, this is to go to a patient.
No, this is, it's still inventory is being delivered to the closed door
Oh, the
pharmacy
ability to like reject it from a
from
processor.
a processor.
But you guys are envisioning that it's gonna
Are you-
come from the pharmacy
Yeah.
to
Two, is
not
that what
directly
you're?
from a
Because
processor,
they're
right?
just storing it to go to deliveries.
My-
So it's already went through the pharmacist. It's
My
already.
only concern with that, and this might be a process thing, is my understanding is when if you're taking those products, if you're just splitting them off, they get new IDs. And as a processor, we print those IDs on the fact pen.
Yeah, there'd have to be some sort of allowance to not have to split the package.
Yeah.
To allow us to take a certain amount of inventory to the,
Yeah.
to the closed door pharmacy without having to change it in our inventory, right? So we can have 150 at our pharmacy in Bountiful and 150 there, but all be tracked.
That's
So-
300.
So you
Same as a
guys
total
list the
300 back.
package number on the individual.
So if you
items.
split
Yeah.
it, so like with at our processor.
Yeah.
Right, if we say, oh, we're gonna fill an order of 50, but we still have 100, when you split that off, it's a new package ID. I don't know if the new system will be capable of maintaining that package ID integrity, but that does get tricky.
Yeah, that would actually be.
And to go back, that's why I was thinking of rejecting, like, I was assuming deliveries were happening to the closed door pharmacy, not the other way around. Because of that error. So yeah, if you
Yeah,
know,
we can look at that and
Yeah.
just talk about those couple things.
Yeah. Right. yeah, those are the only items I have. Does anyone else from the board have any items?
I definitely do. but
I-
unless
if
anybody
you-
else- unless anybody else wants to go first.
I knew you did.
First question, just on that, under the licensing, what's gonna be entailed in a willingness of a closed door pharmacy to carry our brands? Is that just gonna be a statement in your operating plan that you're willing to do so?
Yeah, I mean, obviously, as we put over and over again, I've been lawmakers, patients, if you want to be able to put that there, but it's mostly gonna be based on the operating plan and any change to that.
Okay, so just be a statement of the willingness to do so. Okay. Under R 66.
I should say, sorry, that we'll follow up on that, right? There should probably be reasons why not, why it's not happening or why it stops happening, you know, certain.
Understood.
Yeah, the board would be able to, in the future, not renew a license if they're not meeting the things that they said in their operating plan.
Under R 66-10-4, looks like it's 2BI. It talks about some records that the closed door pharmacy would have to maintain, and it talks about, you know, a list of employees. You guys have included work schedule, and we reviewed all of the other rules for every other license type and have not seen that work schedule is something that we're required to keep. So just wondering where that came from and why we would add something that's not in any other rule.
It's really because we're envisioning that this may not always be a full-time type of thing, and it might be kind of something that's left alone in aspects. So in case there is ever a situation, we would like to see who was working at the time.
If they're not operating 24/7.
Understood. I think it's just interesting to add additional regulation that doesn't exist in any other context. All right, moving on to what is my main concern. And this is something that we've talked to the department about in relation to our own pharmacy. I think thinking that these closed door pharmacies are going to carry far less inventory than a normal pharmacy is incorrect. They may not carry 50 to 60,000 items at a single time, but they are going to be carrying tens of thousands of items, especially if there's only 3 that are going to be given out by 2027. And back, I remember when Rich was in charge of managing pharmacies, we discussed the idea of inventories, right? There was kind of an informal inventory process that existed. And that was eventually codified into rule. And I remember when we were speaking about that, we talked about whether it should be a daily, whether it should be a weekly, whether it should be a monthly, and ultimately we landed on a monthly. And even if it's 10,000 units, say that's what we carry, the expectation that will be counted daily, reconciled daily, and reported as otherwise required, I just don't think it's feasible. Currently, you've come and seen, you know, our process. We count our entire store on the 3rd Sunday of each month. We do some additional recounts that night. We come up with a list of variances, and then we spend the next 3, sometimes 4 weeks before they're due to you all, reconciling those, you know, those variances. Sometimes those variances are in relation to obviously mispicks and things we could do better, but more and more we find those are due to the system that is MJ Freeway. So as I've said to the department before, I think once we have a good ICS system, we could maybe consider something like this, but this is going to add additional labor, and this would essentially make this an around-the-clock operation. I do not envision, certainly if we apply for one of these licenses and were to get one, that we would only house a few hundred items, you know, here. So this again does not track with what the current rule is for pharmacies, and I hope this is not where we're trending. For pharmacies, the monthly inventory counts have worked well, and we report on them each month. So I would encourage the department to reconsider daily inventories. It's just going to add additional labor, additional costs. And one of the things we've all been discussing and is going to be discussed again today, you know, at length at the legislature is the cost. Those costs have to get passed, you know, somewhere. And unless someone can help me understand why the monthly inventory system has not been working, that we've now been under for multiple years, seemingly without, you know, significant incident, or at least without significant negative feedback on that process, why we couldn't just go and follow the same process we follow for pharmacies. I think this would dissuade some folks, you know, from necessarily applying. And I think we'd be spending more time counting items, trying to reconcile items than getting medicine to patients. We understand the importance of a good tight inventory, but honestly, until we can get a trustworthy ICS system that doesn't create variances on its own, it's really hard to say that we could be supportive of this. So we would suggest that it be moved to a monthly inventory like we have currently for pharmacies. And I think otherwise that was all the more that I had, at least for the rule itself. I did have some just kind of, timeline type of questions. When does the department plan to put out, the RFP for licenses? Does it plan to issue all 3 right away, or kind of help us just understand logistics? So those who are hoping to apply can kind of understand what that's going to look like.
There'll be an application that is posted ready, is the final again, which we believe will be ready by the time this rule is in place. Then it goes into effect, and we put that out there at that time, make sure for sure that the rule is going to be put into effect. It won't necessarily be an RFP aspect, that thing that we take in, obviously includes the numbers are obviously less than there with down there. So there'll be a scoring system that if need be to go to the board for a review.
So the application window will open for a period of time. Everyone will submit their applications, and then they'll be scored by the board.
It'll also be dependent on what counties it is, right? Yeah, I mean, the process of scoring for the most part, and there's some exceptions, it's gonna be based on those counties of class 1 and class 2. Right? If someone wants to put someone and no one else applies for something, then you don't mind that person's gonna get that one.
Understood. Okay. And then you may have said this, but all 3 will become, you'll issue all 3 of them at the same time?
If there's people to bid, and it's
There's enough applications.
Enough applications, and it meets all the criteria type of thing, so.
Okay.
We also understand that it's a meeting all these and having another individual location, there's gonna be a lot of costs that involve a lot of things that we talked about too, so it could possibly be an ongoing thing for 6 months to a year as people decide. It'll be interesting to see.
Okay, thanks for answering those questions.
Anyone else from the board have any comment or questions? Board of Agriculture. We do have an individual that's signed for some public comment. We'll turn the time over to those in the room. If there are any online that would like to make a public comment regarding the closed door pharmacy, now's the time to raise your hand and you'll be chosen after the public comment from the room. Nara, are you wanting to make some comments?
Good afternoon, everybody. And Eric, the Dragonfly. I just want to make a comment in regards to R66-10-3-2 in regards to the licensing criteria on there. There are a few points on there that appear to be somewhat subjective in nature. That's point B, point C, and point D. And I think, when it comes to an RFP, and having people to be able to strategize and put together a carefully crafted RFP, it's going to be really important that the criteria is very objective, right? It determines strategy, it determines where we put a location, how far from another pharmacy location would we be allowed, so that way we're not spending significant time and effort planning for a location that is otherwise deemed not fitting the criteria, right? We say current pharmacy location, does that mean nothing will be approved within a 30-mile radius, 10-mile radius? That allows us to determine to find locations, identify areas of need the most. So there are a few elements on there that, as somebody that might be applying for this, I have a very difficult time writing an RFP that addresses patient needs, not knowing exactly what that means. Is it pricing? Is it inventory availability? Is it services such as delivery available? So there's a whole host of criteria that I think is crucial in this RFP, because by making it more objective, it takes the subjective nature out of awarding licenses to people and creating any, potential issues in how licenses might be awarded, or maybe hurting feelings for people who put a lot of work into an RFP and don't get awarded when they think they have a really good one. So really just wanted to make those comments in regards to having more objective inputs into the criteria of what we're winning for the door pharmacy license.
Thank you very much. Did we get any requests for online comment? All right, yeah, I think, I mean, I don't know if there's necessarily, if anyone has any suggestion or motion. I think there's some changes that we've made. But I'll open up to the board if there's any formal requests you're wanting to make.
Yeah, I'd like to make a motion, that under R 66-10-9, 5A, and anywhere else where this, also under, subsection 10, under this same section of the rule, anything that relates to a daily inventory, be removed and replaced with a monthly inventory that tracks with the current rules for medical cannabis pharmacies.
It looks like A, C, and 10.
Just trying to look.
Yeah.
Yep, so I think it's, yeah, so 5A,
C,
C does talk about it, and then I think 10
10.
talks about daily inventory.
correct.
Yeah, so that would be my motion.
I would second that motion.
One question, we'll take it to vote. This is to Cody. Was your intent to mirror what was in the current? Pharmacies?
For the most of it.
Okay,
Yeah,
it was- so that's just a change.
This is
Okay.
Still a different, beast, so
Yeah.
to speak, and give you some changes.
Okay. No, that's fine. Okay, we'll go ahead and let's take a roll call vote on that motion.
Ken Anderson,
Aye, yes.
Nanette Beresney,
Yes.
Tammy Clark,
Yes.
Desiree Hennessy,
Yes.
JD Lauritzen,
Yes.
Chris Morgan,
Yes.
Matt McCabe,
Yes.
Missy Smith.
Yes.
All right, here's if it's that, as if that was unanimous.
Looks like just reviewing too, looks like it's on 66-10-10-9 4-A as well.
There's one there as well.
Do we want to talk about the work schedule?
I'm just gonna make a separate motion as well.
Yeah.
On that.
Is that-
Yeah, I'll go ahead and make a second motion too. Just since we're trying to keep this as consistent as possible with the pharmacy rules, as stated by the department. I would also make a motion that we remove anywhere in the rule. I know of at least one place I see it for sure, but if it's under other places, under R 66-10-4, I would just say that list of employees just needs to include the employee name. The fact that we are required to keep surveillance cameras right throughout the facility would allow anyone familiar with the facility to identify who that person was at any one time. It's just more record keeping. And I don't believe it to be necessary. So my motion would be to remove the reference to work schedule anywhere that it appears in the rule.
I'll second that.
All right, we do have a seconded motion. Be able to get that, Abby? Okay. All right, I don't think we need to repeat it. Everyone understands what we're trying to get done.
But maybe before we
you
vote,
have any
maybe the
questions?
department could respond. Is there
We'll take it under advisement.
Okay.
Yeah. Yep, then we'll go ahead and move that to vote, a roll call vote. Abby?
Ken Anderson,
Yes.
Nanette Beresney,
Yes.
Tammy Clark,
Yes.
Desiree Hennessy,
Yes.
JD Lauritzen,
Yes.
Chris Morgan,
Yes.
Matthew Page.
Yes.
Yes.
If there's not any other board discussions or any movement or motions to be made, we will go ahead and move on to our next item. And again, we will turn the time, this is on the UDF legislative priorities. And we'll turn the time over to Dr. Forsyth and Mr. James.
Thank you. So right off the bat, we can scratch the first two bullets there. We've had some discussions with the HHS and our attorneys and found that it's not necessary at this time to pursue either of those. So we'll be removing them from our requests. Next, it's an item that you guys have had presented to you before, the strain names. Remember, there was quite a bit of discussion and some back and forth on that, and that seems to be the case whenever this is brought up. We still do want clarity from the legislature on this because it's something that we get pushback on. Not necessarily that we're gunning for any particular outcome, we would just like clarification on it. We also are seeking clarification on the process for advertising. allowances that were put into place in the last session. To even the playing field between processor advertising and pharmacies for those that don't have access to a pharmacy. We're asking that the requirement for work facilities to be listed on agent cards be removed, as it's not really possible in the new system, and it also makes it easier for agents to move between work facilities. We're asking for references to the state central patient portal be removed because these are outdated. That doesn't actually exist. We're asking that, and this is something that patients have complained about. We've received several complaints from patients about not being able to see the back panel of a product they're trying to purchase prior to purchasing it, so that they can make sure it's what they want. So we're adding that request, and this would include online sales. And because of that, we are asking that this have a delayed implementation to give pharmacies the opportunity to get everything up to date in their system. They're going to have to add additional images to their product profiles online. And we certainly don't want to put them in a tough spot there. Similar thing on COAs, we'd like these to be available to patients, preferably on the department website once we get the new ICS system up and running. Again, this is something that's going to take a little bit of time, so we want to lay the implementation on there as well, but we feel like it's a valuable resource for patients to have to be able to look up all the testing information on the products they're buying. Next would be kind of an open question to the legislature as to whether they would like the courier renewals to go to the licensing board, as all the other licenses are handled currently. Then change to how the licensing board is considering the cultivator renewals, to have them all occur in December. But then the pharmacies and processors to be staggered when they naturally expire. And on the backside here, pretty small change we filled to the pharmacy ownership change notice to take it from 10 days to 45, so that it can actually go to the board. It's just not possible to take it to the board with that 10-day notice. And we've been contacted by the AG's office, and they're requesting an update to the antitrust, anti-competitive language. We don't actually know what that request is, but we're just requesting it on their behalf, and they're going to give us some language hopefully soon so that we can review it. They feel that they need some changes to make things more enforceable. And then kind of the last one, actually no, we had one more below that, but a fun one and hopefully positive for the environment, allowing patients to bring reusable bags into the pharmacy to use to take their medicine out of the pharmacy, as long as it meets the requirements that are currently set in statute. And then lastly, another kind of cleanup item, just removing the video recording language from the ICS language in statute, because they really are two separate systems. One more on the security side and one's on the inventory side. That would better reflect current practices by the industry. Any questions?
I don't have any. Does anyone from the board have any questions?
Of course I do.
We don't have any.
Oh, it's a question, Matt.
Yeah.
I'll leave bullet point 3 alone on string names. I feel like the board took pretty decisive action on that, and I hope that will be duly considered. Really on the 4th one about clarifying advertising around processors, and this is going to get a little bit to the discussion later around this website. The way I understood the law, and especially the way I understood the recommendation that we made that precipitated the change around targeted marketing, was specifically to allow processors to maintain a website for purposes of targeted marketing, right? As long as you age gated it, as long as you have the appropriate consent for people to receive or view that type of information. So is there a disconnect in the understanding between what is advertisement versus what is targeted marketing? And that needs to be fixed in law, because if they're allowed to do targeted marketing the same way as a pharmacy, are you saying that the law doesn't currently state that and allow that? Or are you guys just saying because they say they can't maintain a website for purposes of advertising, they then can't maintain one for purposes of targeted marketing?
Yeah, basically, targeted marketing language doesn't explicitly allow for a website.
But it does talk about like electronic communications and things like that, which essentially is the auspice under which we all as pharmacies are maintaining websites that engage in targeted marketing, right? So,
Exactly, so that's why I would like a little bit more clarification on it.
but if a processor today, under the current targeted marketing rules, say Blake back here decided he wanted to host a website, right, that provided information regarding targeted marketing, as long as he met the age gate requirements and the other consent requirements, he could currently do that, the way the law is being interpreted by you all to allow pharmacies to engage in that behavior, right? That could be done today. Or are you saying a change in the law needs to happen to allow that?
I'll defer to council on that one.
Is your counsel here by chance? Okay. Because it's been my interpretation in looking at it, and I honestly think this is going to really lend itself to the discussion we're going to have here shortly. This is something that can already be done and probably will be done more accurately and with better specification, I think, by industry. So I believe that this can already, be done. So if your counsel would enlighten me, or have them reach out to me, I'd love to know one lawyer to, another. Happy to be disabused by ignorance if I'm incorrect, absolutely.
I think that would be a good thing to update the board on as a whole.
And yeah, I think. Questioning that.
Because that's been some of the conversation as this has kind of progressed around this website is, well, processors can't currently do this because they can't maintain a website for advertising. We agree, they can't maintain a website for purposes of advertising. But the way targeted marketing has been interpreted to this point, and the fact that that was explicitly what was recommended by the board, I would think that was what the intent was, but I'd love to know from your counsel what y'all's position is, because you're going to hear here shortly that we believe that independent operators can maintain the website that's being kind of kicked around here and on the next agenda item. So just would love to know more about that.
Anything else? Do we have any public comment? There's nothing listed for this room. If anyone from the room would like to make a comment, you're more than welcome to, but if not, I appreciate the time to provide us with those updates. I know there's some of them that are going to be impactful for the industry and for patients, and others will make things easier.
Getting rid of bags or reusable bags is a really brilliant idea. I have so many bags that I have nothing to do with, but recycle them. It's a waste.
All right, we will go ahead and move on to the next agenda item. So this is item 8, medical cannabis statewide product inventory website. So I will do a memo has been circulated and has been posted on the public meeting website. But kind of going without having to read it all word for word, I do kind of want to go through some of the background and some of the information that we have. We do have a presentation from that Trevor's put together on. Do you have the? I was going to ask you. Now, I think we're just talking about it. Never mind.
Yeah.
So there were a lot of questions that came in on this website, what it entails, and so I did have Trevor kind of dig onto the state side and find out some things for us. But really, kind of going through here is since I wrote this, right, since the start of the program, we've seen a total of 153,000 patients who've received a card. As of August, when I got the numbers, there were 88,858. We've grown in 1 month by just under 700. So that's kind of where we're at today. I don't know how many left the program on top of that. We have seen a lot of growth initially into the program. And I think as discussing with many individuals and those in the industry and without is, we have seen quite a dramatic slowing of the program beginning of the middle of last year. And not only in patient growth, but in patient retention. And so that's where a lot of these surveys and things have been done. And so looking at the information that is on there, really, 54% of respondents choose that it's too expensive to remain in the medical cannabis program. And that was the survey that was just completed on why individuals chose not to renew their card. So the entire kind of short story of this website is I've heard from several patients, I've heard from several within the industry that they would like a mechanism in place that would allow patients to find and access all medical cannabis products within the state of Utah. But also allow it to be where they can get information from that, such as price, location. I did list in there like the ability to have potential like THC amounts, terpenes, the COA. Again, a lot of those were wish list items. I think as a patient, people would love to see. And it's easily accessible for the patients, so they don't have to continue searching through different websites or through of different processor websites if a processor was able to list these items. And so in kind of going through and discovering this information, the four main points of why I feel a website is important is A, pricing transparency. That's an item we've discussed at length. We talked about the product pricing and cost going in our last meeting. That is an agenda item for the governance group today, is pricing transparency. And if patients can see the prices across the board on how things are listed, it gives them better openness into what items are at and give them the choice in what they're choosing to be hopefully the best savings for them. Secondly is access to the medicine within the program. I've heard countless stories of patients finding a medical cannabis product that's working for them, ultimately to find out that it's all of a sudden now gone from their pharmacy of choice. When they try to request that item, they're either told, well, that item doesn't exist anymore, or here, take this item. This is a comparable. And many times, not all times, that product will work for them. On the flip side, it may not work for them, as cannabis can be, recipes and formulations can vary. So again, this will just allow patients to understand, as this is on the processor level, not just the pharmacy. So it will show that as a processor, maybe they do have that item and maybe it is not in stock anywhere. But it ultimately will allow the patient to see where those are found. And through the trust and testing in here, and this is kind of goes off of one of the legislative priorities that UDAF has mentioned, is just piggybacking off that idea of allowing a link to the COA for all these products, so patients can not just see what's there, they can see how those items were tested and the exact results. So they could verify that, yes, this is what I'm getting and what I'm looking for, and not have to rely on maybe something that was entered in on another website. And then lastly in there is the ability to order items direct to a pharmacy, as not all items are found at every pharmacy. And the assumption is, well, they can just order it through delivery. Most people don't do that, or they don't deliver, or the item found that could deliver to them may not be there. And so I'm proposing kind of a method in which the patient can request an item, to which then it could be delivered to the pharmacy of their choice for pickup. Now, again, there's a lot of what ifs that have been asked of me. What happens if this and this happens? And I don't have all the answers, but my kind of general proposal was, essentially, if maybe it's charging them a fee to get that item requested, that's non-refundable. And that way they're more likely to pick up the item rather than just put in erroneous requests to flood a pharmacy with items that they didn't really want. But only one patient was looking for. Again, this just goes back down to access. There have been several meetings and discussions about the disadvantages to implementing a statewide website. The most common for the two that we've seen that I've heard, and I will address, there were several letters that we did receive from those within the industry, and the common theme on those ones were the two that I address in here: the implementation confidence and maintenance costs, and secondly, the inventory accuracy. That was their biggest concerns on why a website of this scope shouldn't even be discussed. And my answer to that is, yeah, I do understand that, there can be potential increased costs for this. At the end of the day, I think it's all about, that's not us as an advisory board to determine whether or not costs are going to stop, or what's going to be able to provide patients with the best medication. And I feel, as a producer and as a grower, and, it's something that we're doing what we can to ensure that these cost savings are passed on to patients. And that if there is cost, we can, it'll be addressed, and I'm sure that if it's an outrageous amount, the legislators, as many times as we've seen in the past with things that we've recommended as a board, they've chosen not to even address. And so it has not stopped us from voting in approval on prior items, because of the cost. Accuracy, there are times where accuracy can be difficult to ascertain what is the correct number. We hear it multiple times, and there has been difficulties with our current inventory control system. And that does link to a lot of the websites that the pharmacies are currently utilizing. And so if that inventory is off and currently if they show up, the inventory wrong, and they do get upset at the pharmacy. I think we'll have the same issue regardless if it's on the pharmacy website, a processor website, or on the statewide website. There will need to be a disclosure stating that these numbers are subject to the most recent update, whatever that looks like. But at the end of the day, I don't think most people are accustomed to not specifically knowing what the official count is when they're going into a store. I just know that it isn't unheard of for an agent or for a patient going into a store and then all of a sudden that item is sold out. And so they do deal with that. And lastly, I'll kind of brief over these ones. I think that, I've been told that patients could drive their purchasing decision by price, and price does not always equal good medicine. I think the state of Utah has implemented a very rigorous testing process when it comes to all the medication that is available to Utah patients. And we typically have some of the best products as far as quality available. Now, there are differences in how products are made. There's different types that have preferences that patients may have. I don't think those should be taken into account on why we should not or have this type of website. And at the end of the day, people do make a lot of purchases based on price. And lastly, on here is patients can already compare inventory and prices on pharmacy websites. We don't need another website. And I know it has been addressed already by JD on the prior topic of allowing processors to have a website. Riverside currently does not have a website, and is mostly due to the way we read the rule is I can do targeted marketing, but my marketing really can't go to a website because a website can, for some interpretation, be seen as advertising your products. And so until we see further clarification, we've chosen not to pursue any sort of website. Secondly, with a processor website, I mean, I may be able to direct patients towards certain pharmacies across the state and where they can find products. And this is the same a concern I've heard from multiple operators within Utah. They sell items there. Doesn't necessarily mean it's available yet, as there is a process in order for them to accept and push out the item to be sold, or they may be sold out. I don't know their run rates. That information is not shared with processors. We're just fulfilling orders that a pharmacy puts in. And so ultimately, at the end of the day, my recommendation that I'm looking at pursuing today is, we're recommending to the legislators of a creation of a statewide inventory website that can not only disclose location and of all product types of all categories and subcategories, but can focus in on the information that will help patients choose specific products that will help them out. And that's kind of what I'm looking forward to in today. And so, I just advocate that the board recommend that the legislators look at ways to improve access and transparency to our Utah patients and through the functionality of a website. So any questions or any comments? I'll open it up to the board.
Question.
Yeah.
I think overall the idea of having a website that would list everything, it sounds great in my mind, to be able to just go through every single item, find every single price. One of the challenges, you mentioned the Department of Alcohol Beverage Services, they've got their locator and website. That's connected all to a same inventory system. With this proposal, would you be recommending, I think for it to work accurately, everyone would have to be on the same inventory system. Is that something that you would be recommending through this process?
Yeah, great question. So we currently do use one inventory system.
Okay,
So we're utilizing MJ Freeway, and what's happening right currently is our inventory control system is being put into a database under the kind of umbrella of Salesforce. And so they can utilize different types of connections, such as a very common interface is called Dutchie. But that will link, all the data will be stored back into Salesforce. So, I mean, as far as housing all the data in one area, it will be centrally located.
and it would be dynamic, you get your shipment that morning, you update it, boom, immediately updated to,
Yeah, I mean, I can't speak, I've only been in the sandbox
okay.
for it up until obviously we haven't been live. That's supposed to go live on what is it? Well, tentatively from what Brent, but I don't know if you want to answer that question, Brandon, from what
Yeah,
you've
it
seen.
Should update.
Should update. Thank you
Yeah.
for that answer. Another question was this pricing. I saw this come in one of the memos. There's dynamic pricing that happens on these product items as well. Would that be something this new system would be able to accommodate?
Again, I'm not privy to kind of I don't have a pharmacy, right?
Yeah.
And so I can't see. I've seen the Salesforce side of things on the information that's in there from like sales data and what's available. Really all I'm asking for is not these unique sales and specials that we find at pharmacies every day. There is typically, when you're receiving an item, you do have to put a retail price that is on those items. And that at the end of the day, that for the majority of sales, that's probably what it is for patients. And then it would be up to them. Now, if there's something that Salesforce does link into the daily specials and they can update that way, great. That's above and beyond what I'm proposing. Hopefully that answers.
Yeah, that helps. I
Yeah.
do have a little bit of concern about conflicts that say you found on the website, $50 for an item, you go into the store and it's $60. Is the pharmacy going to be subject to the $50 price?
I mean, I would go back to the statement I'm making as far as the inventory amounts as well, right?
Yeah,
I mean, they may say they have 10 and 10 available and they show up and there's 0.
right.
I mean, the pricing and availability is subject to change. And I think until we understand is this, again, I'm not proposing, like, I don't want to dictate how this is in here. I just want to say, let's get a website. And then at that point, we can let the rules decide what we're looking at. But most updates are like every 2 hours or 4 hours, or 1 hour, depending on the type of database that's being used. And so if there is a delay, it could be because of that. But whether or not the pharmacy has to hold to that price, I don't think that's not something I have an answer to today.
Okay, thank you.
I will say that I think that obviously this is a tool that is been shopped around a little bit. It is important to remember that Representative Daley Provo, she has a little task force going right now that is kind of working on this exact thing, looking at this and the feasibility of it. And in this group, we can take these concerns like cost and accuracy and decide if, instead of like just building a website and then saying, how much is this going to cost, or are we going to be able to make it accurate? 100%, I think this would be beneficial for patients. Is it possible is the question. So my personal take at this point, and I would love to hear everybody's comments, honestly, is let's take this and say, as a board, let's have Representative Provo continue to work on seeing if this is feasible. It sounds like Matt's plan and Jen Daly's are very similar, and all the comments that she's gotten. So, for me, I'm just like, I feel like this is already happening, and I feel like we're looking into these things. I think it's going to take a little bit more than just a board vote to determine if we can make this worth the time and money that we would put into it to get going. But in the long run, I think we also need to be coming up with, if this doesn't work, we need to be coming up with ways that we can compare cost, help patients shop and find product that works for them, that they know where it's at, and that they can and get I do like the fact that they can shop sales, and maybe they can't buy on Wednesday, but they can hit a sale on Tuesday. So if we could implement that so patients could see sales and really get a good view of the products that are out there and the availability, I think that would be awesome. So 100% on board, but I think my idea is that we just say, hey, we support this. Let's let Representative Provo take this and finish it out.
Thank you.
I think to build on what's already been said, I think we have to remember that our role is to make recommendations. And I think one of the first things, getting back to JD's point earlier, that we need to strongly recommend is that we get some clarity in what the processors are allowed to do with their websites. Because I think at the end of the day, what we're going to find is what's wanted may be very redundant with what's being asked for in this recommendation. And I think the most efficient way forward, first of all, is to get what's already been recommended by our board clarified in terms of the legality of what can be done with their advertising, targeted marketing, to get the terminology correct. So I think that's the first step. And then the second step is, once we have a better understanding of that, come back and look, what now, knowing what we know, can we recommend moving forward versus what they're allowed to do and what's still needed to be done. So I think we really have to be cautious and not put too much of this responsibility on DHHS. I think our role is to identify what is needed and make recommendations on how we can do that efficiently and responsibly. And if that is something that can be done by the industry, then let's let industry do that and not transfer the cost back to the patients.
Yeah, I think as a patient, I love the idea of it.
Yeah.
Want access to all the information all in one place would be really great. But my concerns are there's already inventory problems. How are we sure that there aren't going to be on this site as well? But also, who's culpable? Who's going to take the responsibility when that patient takes all their time to go in there? I worry that it's just going to be a blame tossing game, and the patient's going to be the one that's hurt.
Yeah, and I think as a pharmacy owner, I can explain exactly who's going to be culpable. We are as pharmacy owners. And so while I appreciate what Matt's saying, Matt does not own a pharmacy. Matt does not run a pharmacy. Matt is not going to have to face the backlash of patients who get bad, erroneous information. And that's going to be significant. Look, 56,000 patients have left this program. I do not want this to be another reason that a patient decides to go shopping in the illicit market, spend money in another state. We just don't want to see it. So while I believe that patients should absolutely have access to this medicine or to this information about the medicine, the question is, who should be providing that information? I do believe that processors can provide this. And I'm willing to make a bet on that. I said the same thing to Representative Daley Provo when we met with her. That's what we recommended as a board. And above that, I would love to know what it costs, DABS to administer their website. I've heard that we're going to be looking at the 6 figures. I've heard if we potentially add an ordering platform to this, we're going to be looking at the 7 figures. Who's going to pay for that?
Patients.
Yeah. Ultimately, it could be added to licensing fees, and that cost has to be defrayed somewhere. So I believe that there are some laudable goals here to be transparent and to provide this kind of information. A lot of this information is already out there. I understand it might be in multiple locations. We have not experienced some of the same things that maybe Matt has heard, that it's difficult to locate products. It's difficult to determine pricing. I myself have been able to navigate, several different websites looking for the same product in about 5 or 10 minutes. So I really think that, making an open-ended recommendation to tell a lawmaker to continue pursuing this when we don't even know if this is the correct course of action. We don't know if maybe industry can already fill in some of these gaps. I think we're just putting the cart before the horse, just a little bit here. And honestly, we all know, anyone that knows the legislative process, this is gonna come down to whatever the fiscal note is that's attached to it. Everyone knows. That's the reason that last year you did not see the 280E tax reform happen. It had nothing to do with other than that. When it got down to it at the wire, it just was gonna be too expensive, right? It was gonna cost too much money. I really believe that if there is a six-figure note attached to it, even worse, if there's a seven-figure note attached to it, that it's not going to happen. And what I would hate to do is put all of our eggs in this one basket and not explore some of these other options that maybe Des is speaking about. So I honestly just believe at this point, a recommendation by the board would be premature. And I would support industry doing this, honestly. We wrote a letter, as a company. Alex is not here. Thankfully, I know he's listening right now, so I'll tell him I'm happy he's on vacation, going to Hawaii with his family. But he penned a letter, and it is a concern. While we're hopeful that the new ICS system will roll out well, there have been hiccups with the EVS system. Clearly, I don't think anyone in this room would stand up and speak positively about the MJ Freeway system. I'm concerned that if we add this to the Department of Ag's plate, while they're trying to successfully roll out a new ICS system, which we all so much depend on as industry, that it could just cause, more problems than it's worth. And ultimately, it will just be one more reason for patients to decide that 60% that we saw in the UDAF survey, for them to go to the illicit market, right? For them to go support economies of other states. And if what our goal is to really find ways to bring more patients into the program and retain them into the program, I think we should be looking at things like telemedicine for every single doctor visit. I think we should be looking at expanding qualifying conditions to allow for doctor discretion, those types of things. I think those are going to have a real world impact. They may not, but we believe those are more program lifting type of endeavors. And so at this point, my recommendation, and my vote will be no. But for the reasons stated. Could my mind be changed later if we get some better answers? We understand what the cost might be, and we really understand whether this is already something that could happen. And this isn't. It's my word that I struggle with to say the most, superfluous. Oh, there we go. It was a pretty good job of that one. I wonder if we're just adding, we're adding, 3 pieces of cheese to a cheeseburger that already has, 2 pieces on it.
Well, yeah.
Facts, brother.
You just lost Chris.
It's all good if I lost him over a piece of cheese.
I also think since Department of Ag wants to see the COAs on websites, that takes a big component away from the point of the website, at least for me. If I had access to those, that would change a whole lot of my decision making.
But it would give patients the ability to see one product compared to other similar products. There is benefit, but I do think that the processors do have the ability. I just worry that cost and accuracy, which is already being studied by JDP. So there would be some benefits to get on and see that you have okay, I have this tincture and it has this much beta caryopylene, and guess what? So does this one. And even though this one's not available at my pharmacy, maybe this one will match. And I think it takes kind of the guesswork out of patients standing there and trying to pick the right similar product, but cost and accuracy. And right now where we're trying to drive down cost, that makes me nervous. Accuracy makes me nervous. And I think we're already studying. So I kind of am like, let's agreed, but we're kind of doing it.
But again, I'll reiterate, I think we can clarify for the processors what they are allowed to do in terms of targeted marketing, because I think they will be able to address some of the missing items under the current legislation without having to ask for any changes.
Yeah.
With some clarification.
I think we probably request that your council, depending on what the vote is.
Then let's make a vote that we
at the next meeting, so we
get
can understand
clarification there.
UDAF's position is on it.
Well, my understanding is UDOT's already requested for that clarification from the legislators. They're already looking at, because there is language in there that says we can't advertise through a website that's as a processor. So how that's defined and interpreted is up to your company's lawyers. I'm not gonna tell you how to run things. Or advertise if you're just a processor, but at the end of the day, it's the intent of this, to all of your points, I appreciate all the comments I've heard, is we want to ensure that patients have access. A lot of people have brought up the cost and what's in there, and I know I did reference DABS, and that was one of the meetings I had Trevor get to, so I'm gonna have him share. So there's nothing in state statute that require the Department of Alcohol and Beverage Services to have a website.
No.
So Trevor, do you want to elaborate on the meeting you had? A little bit on there?
I can elaborate a tad.
Yeah.
We confirmed with DABS that there's no statutory requirement for their product locator. For those who might not be familiar with it, if you go on their website, they have a tool that allows you to look up any kind of alcoholic beverage in the state, and will show you the stores it's currently stocked in, the quantity, the price, as well as the warehouse inventory and any inventory on back order. But this locator tool does not have any kind of ordering system. It's merely information about what's at which stores. And we were told their implementation was around 100,000. And there's some annual upkeep costs too. They have a couple folks from the Department of Technology Services help maintain that website. So there is some added cost to that ongoing.
Obviously, I mean, if you look at their revenues are slightly greater than the medical cannabis. As it's a state program, it's all within the state. So, I mean, they do have the funds available, but I know cost was brought up and fees and who's paying that. One of the questions I can have, this is for Rich, is what is the current balance for the medical cannabis from the transaction fees? What are we seeing that add up every month? And what's the current, what are you expecting to spend in the next 6 months to a year on that?
Yeah, I can just provide some general information about what we expect, what our projections are. As far as revenues go related to the pharmacy uniform transaction fees. So projected at the end of fiscal year 25, which is June 2025, we expect that to bring in about 4.6 million during the fiscal year total. That's how much that one fee at $3 per transaction would bring in. And then we project over time that that'll increase in later fiscal years. Yep.
Do you have what the current balance is that's in that?
So our projection for the end of this fiscal year in what we call the capital of our savings of our program, that's expected to be at about 8.2 million.
Okay.
And we know that we, like any state agency, we do have to maintain some in savings or capital, right?
Yeah.
And so based on advice that we've been given, our goal is to keep that in the future at least 3 million. And so lawmakers will be discussing during the legislative session how they like to use that difference.
Extra.
That's something I think they'll be
5 million.
They'll be considering. Yeah.
Okay. I mean, thank you. Yeah, I mean, I think when it comes to costs and things like that, I mean, if I remember correctly, the note for the 280E was like 1.7 million, and that got thrown out. I mean, I think for the funds for availability and cost side for a website like this, to JD, what JD brought up is, I mean, it's not unheard of to have a website be 100,000, $1 million. I don't know if that's, I mean, who's running that website? That seems very expensive. I mean, it depends on who's doing it. If it's state of Utah doing it, and in the meetings that I've attended and talking about this sort of process, this website. I mean, it's not necessarily the state creating the website. It could be an RFP where they outsource it to a third-party company. And I mean, many companies out there would propose some sort of bid to get in there. And so, I mean, that would be in there. So, I mean, the cost, I'm not saying how we spend it or whatever, that's up to the legislators to decide who pays for this. But I mean, to me, it sounds like there's potential for money from that fund to help get better access and education to patients. And that's the entire goal of the Department of Health for the Center for Medical Cannabis, is to make sure patients have access and have education. And that's what I view this website as, is just a means to provide them with that. All right, are there any other comments or anything from the board? We do have quite a bit of public comment. Maybe should we get to them? Okay, we will go ahead and open it up to public comment. We will start with those within the room. And then if you are online, if you'll just kind of follow the outlined process to get to be heard, and then we will get to you when available. I'll just kind of go down the list, as we have a lot of people on here. We'll start with Mindy. And if you don't want to make any public comment anymore, you can just let me know. I can scratch you off.
Hi, I'm Mindy Medeo. I work for VI Pharmacy. I'm also a pharmacist. I purchase products and work closely with processors at the 2 pharmacy locations. And most importantly, I'm a cannabis patient. Thank you for everyone's work on this. I do think patients do have the right to have access to this information. I like the idea of one spot to compare products and prices, but before we jump to such a costly solution, I've got 3 ideas, 3 steps that we could take to get the same results. Number 1, the processor website. We've talked about this before, but we need to allow processors and pharmacies the freedom to advertise their products. Number 2, the state website needs to provide very easily links to navigate to pharmacy websites and processor websites. Let's see, I know firsthand how hard it is to maintain the accuracy of just one pharmacy menu. And I'm not at all confident the state can provide this accuracy and completeness in combining 15 different pharmacy menus and accurate information on each batch of every product purchased in Utah. Number 3, I think the state should be more strict with our pharmacy menus. This is more work for me, but I think the pharmacies should provide COAs for every single batch. I think you should focus your enforcement on the accuracy of our menus, or make sure our THC percentages are accurate. I think you should make these 3 changes first, which I kind of see as taking steps in these directions. Give them time to work and then reassess. As far as special requests for specific products, I've worked as a pharmacist in charge at 2 different pharmacies over 4 years, and I have received only a handful of special requests from either patients or processors. This, I promise you, this is not a problem. This makes me question, is this need for special requests a common problem for patients, or just a ploy to help processors increase their profits? So our program can remain fiscally responsible. I would request more data proving that.
Thank you, Mindy.
Thank you.
All right, next was Alan Roth.
Hello, Alan Roth, Director of Compliance for Curaleaf. Just to keep this simple, Curaleaf has asked me to come forward today to register its opinion on this, which is a strong no. For some of the following reasons, beyond all the items mentioned today in person, beyond some of the letters that I haven't seen read here during this meeting from some of the other licensees, it seems to me that given that there are other ways to bring costs down, given that this is an expensive, complicated solution, really feels like it was not written from a pharmacy perspective. It feels like we're addressing something that doesn't necessarily need to be addressed through a single portal. So I've been in the cannabis industry for 8 years. I worked for a multi-state organization. I've worked in 5 or 6 different states. At the moment, to my understanding, there is not a single state in the country that considers this to be an advisable path forward. If it was, as Utah is not the oldest programs, I think it would have been done already. There are challenges involved, there's culpability issues involved, and we've all seen that ultimately, while one can paint a picture of a perfect scenario in which prices magically are always correct and that discounts are always available to be seen there, it's not going to happen. It's just the odds of it actually working. So I want to add one other thought as a personal thought. This is not a Curaleaf comment. From my experience of monitoring these meetings, it seems to me that the patient complaints, and can I ask for an extra minute, please?
Yeah, that's fine.
Thank you. What I've seen, and I've monitored every single meeting of this board, which I love, I think this is a great, great thing. The patients seem to be more complaining about pricing compared to the black market. Right? And there is nothing that is gonna change our ability to remotely reach the black market because of all the obvious, the testing, the expense, et cetera, et cetera. So we all know that towards that end, it's not gonna happen. We know that there are great ideas for increasing the size of the patient population, as JD has mentioned. We know that having the processor website could be very, very helpful. It seems to me that there's lots that could be done to help feasibly reach a point where we're doing as best for the patients as possible. And it seems that everybody here agrees, we're all trying to do our best in this situation. Thank you for listening.
Thank you, Alan. Right, Blake Smith.
Minutes is fast. I'm gonna speak fast.
All right, speak clearly, so the people online can hear you.
Blake Smith, I'm the Chief Science Officer and also CEO of Science Pharmaceuticals. Products that do what we're asking to do already exist. We Mass and Leafly can already tell you what products are available and where to get those. Implementation costs, more government is not the answer on this. ICS already is in flux, so adding more burden is not the answer. I don't believe the ICS in its current state can do instantaneous forms. And so we're gonna have to go and re-hit that system again. Also, if cannabis reschedules, then requirements will not be negotiable to meet CFR 11 and CFR 58. That compliance and the information management system can easily exceed $500,000. So that's just a fact. And anything that, and so I don't think our inventory management system should be the Dollar General, so we shouldn't just throw it out and get the cheapest one. That sounds crazy to me. Also, we keep treating cannabis like grass, generally accepted as safe. In pharmaceuticals, ingredients are grass, but medicine is not. It's created very specifically for specific physiological purposes. And so recipes and formulas do vary, but physiological active molecules are dose dependent. And so just the fact that we all produce gummies doesn't mean all gummies are produced the same way. And price is not the measurement to determine if a medicine is appropriate for a patient for a certain condition. And so instead of talking about this in terms of our measurement sticks, we should probably be using measurements for quality or some other type of thing. And so, and that information should be available to patients. And so how we do that, I don't think it's through a government-run system. I think there are probably lots of people in this room who can come up with ways that it's done all across the nation. It's already been done before. Thanks.
Thank you, Blake. All right, Nareth.
Yeah, Dragonfly here. I just wanted to share one example of how a producer is already creating a very low-cost alternative to access to this. You can go right now to dragonflyprocessing.com/COAs, and you can see every single COA of every single product that Dragonfly has ever made in the history of the cannabis program. It's readily available. I can't tell you that it's no cost because there's literally somebody on our team that uploads every single COA because they have to manually extract it from an MJ freeway system that should be easily connected, right? That's the reality of the situation. So can I say it's a no cost? Somebody's paying it for along the way. We have to pay that employee, but these are doable things, right? And these are, if processors have the ability to be able to do this, it allows people to take control and responsibility of their own quality of their products, right? It's no secret that Dragonfly is probably one of the higher priced products in the state, right? We believe in quality, we believe in added value, we believe in quality ingredients, all these things matter. And it's important for patients to be able to see that, right? It's important for us as an operator that patients are able to see the difference between quality so they do know what they're getting. And lastly, I think I'll echo kind of what Alan was referring to into the black market. Let's be real, guys, and we're talking about pricing and pricing transparency. What patients want is an adult use market. They don't want all these extra costs. They just want to be able to buy their medicine. They want it at the cheapest price. I don't think anybody here at the table is talking about adult use. What I see is we are making references to an adult use program, the DABS. And I don't think that's what we want or what we're looking for, right? We are talking about medicine, and if we want to talk about a race to the bottom and the cheapest product, we're talking about adult use. If you shop in any adult use market and compare the level of quality, quality goes down because you don't care in an adult use market where price is the only thing that matters.
Thank you. All right, Bijan?
Bijan with Beehive Gardens and Beehive Pharmacy, where serving two pharmacies.
Can I have you speak up, Bijan?
Just kind of inside it.
Yeah.
Outside. I'm with Beehive Gardens and Beehive Pharmacy. I'd like to echo Nair's point, just from a vernacular perspective, for pharmacies, not dispensaries. I'd like us to not be compared to the alcohol program. The DBS, they have 50 locations, they brought in 500 million revenue, half of which went back into general fund and other areas. That's not anything for us to be compared to, so just wanted to say that. In addition, I've Googled and looked different websites. There's about 3 to 4 within Salt Lake Valley. Can find most products in 5 to 8 minutes. But one suggestion that I would like to make, that DHHS website hyperlink the phone number and URL on the website. Because if I'm a patient and I'm going to one centralized place to look at what stores are available, make it easier for a patient to then contact them. There's no way to click a call and click an email. You have to copy and paste. So that could be one small tweak we make to make it a little easier for these patients to find that. And as an operator, I think we would all, in good faith, ensure that if it is in the best interest of patients to put all the COAs on our retail facing websites, that is going to cost us more additional labor to do so, but I think we can accomplish what we're trying to do here, just in good faith by operators taking that extra step. So thank you for the opportunity.
Thank you. All right, we'll go ahead and move to anyone online. Is there anyone online who's raising their hand? See two. Okay. All right, let's start with T-Bird.
And if you'll just announce your full name.
And affiliation.
And
That's Tyler Lang.
if you're calling from online.
Hi, can you hear me?
Yep.
Hey, this is Tyler with Riverside Farm. I just had one idea for this proposal. I would modify it to make this license privately owned. So a license that the Department of Ag issues, that's just an online website so that the state's not responsible for it.
Welcome.
That's it.
We have box assignments for 6A.
All right, thank you very much. No idea what that was going on.
That'll be a conversation.
Yeah, you're gonna need to, you need to step out and go.
I have no idea. That's not my problem. All right, Paul Henderson.
Okay, can you hear me?
Yep.
Okay, great. Paul Henderson, CEO of Pure Utah Processing. I don't have a whole lot to add, be very quick. I just wanted to note that just like many of the other operators in industry, we are opposed to this. We understand the reasoning why, but for all the same reasons, we just don't think that this is something that we need to focus on now, maybe down the line, but we are against this. Thank you.
All right, thank you, Paul. Do you have a question? You can ask him.
I'm sorry, could you clarify your affiliation? We weren't able to hear you.
Oh, I'm the owner of Pure Utah Processing in Payson.
Thank you. We just couldn't hear the.
I'm sorry. Thank you. Yeah.
And then, I mean, I know it was addressed, the letters of opposition, but just for reference, I mean, we did receive the letter from Holson Co., which JD did address, the flower shop, and then there was a joint letter between Dragonfly Cannabis, Beehive Pharmacy, Standard Wellness, and then Pure Utah, which Paul is here with that one.
Thank you.
Okay, is there any more public comment from the room? at all? If not, we will turn the time back over to the board.
I just want to I just want to ask a clarifying question. If we were to make this private and they were to issue an RFP, would the state not still cover the cost? Like, would they not just hire that? It wouldn't change the cost. Right?
Changes who administers
It
it.
just changed, okay.
Doesn't solve any of the culpability issues though.
Well, and I think one of the things that obviously we're hearing from public comment and alike, right, is this goes back to the process. A lot of comments on the processor website. And I think for us as a board, we already made the recommendation for processors to have a website. I think there's a lot of assumptions made that that alone will solve it. Many patients don't go to processor websites. Many patients, I mean, even as a processor, like I said, I can only speak for my company I mean, I don't have the ability to know how many products are available at a certain pharmacy at a given time that I sell. So if we're trying to advertise and market for a patient on where they can find the products, I can give them a general idea, but if it goes back to the accuracy thing, then I'm just sending someone to a pharmacy and there's nothing there. So, I mean, yes, then I think the culpability then would turn probably onto the processor. You could say, well, that's their fault. At the end, really, what I'm wanting to propose on this for this website is a mechanism which patients have access to easily find where products can be found. I know there's a lot of discussion on cost or the functionality or the accuracy that we're going to see. I mean, there's a lot of what ifs, and this is not something that's going to be happening by December. I mean, we're asking the legislators to put this in rule so that that this is available to Utah patients. And that still has to go through legislator. It has to be signed, and then probably a rule decision has to be made on however it's implemented. The proposal I want that I wanted to make, right, is that as a board, we recommend to the legislators to pursue an avenue in which a state website, and when I say state, it just encompasses all the medical cannabis program in Utah. Doesn't mean it has to be run by the state of Utah. It's however deemed fit, but a website in which all medical cannabis patients can access to easily find products, pricing, and educational material about the products they're getting. Ordering? I mean, I think if I wrote in here a proposal that if a patient wants to order items, there could potentially be a mechanism in which they could request it, whether that goes to the pharmacy or goes to the processor. That's up to the statute that's written. But I think, I mean, realistically, when it comes to ordering, that should be something that I could see done, whether that's a hyperlink to an email to send it to that hits both the processor and the pharmacy, letting know that they're looking at this item. Doesn't mean it needs to be fulfilled. It's a way for patients to let the industry know, hey, I'm looking for this particular item. Where can I get it? And I can't find it at my pharmacy.
The public comments.
Yeah.
We're having.
Oh, yeah, I opened it up, so
Okay,
go ahead.
In our situation, Blake is a great example. We had somebody who we needed RSO at a certain price point. It wasn't there. We called Blake. Hey, Blake, we got a patient. Boom, he made it. Also subsidize the cost to that patient. So these mechanisms currently exist, like we're doing them. And maybe I can't even count how many times we've done that up north, but just in Salt Lake alone, that's something that we've done. Because we were sending Heidi out to Wendover. That's where we changed the end of life law to allow them to go over their allotted limit. This is the same patient that we're talking about here. So these mechanisms exist. We don't gatekeep when someone asks, hey, we need this. Our job is to serve patients. So if somebody wants something, if I get a phone call from Mindy who's doing our buying saying this patient wants this, it's like absolutely buy it so we can sell it. And we're in business of buying and selling. So I feel like these things as good operators who we work with can accomplish those things as is.
Well, I mean, I'll bring it back to the board, but I appreciate the comment. I don't think we're here today to answer these questions. The proposal that all we're looking at doing is we've been asked by the legislators how we can help improve pricing and product transparency in the state of Utah. There's been a lot of discussion. It's not just from, although I wrote this memo, this wasn't put together just from me. And I mean, it took a lot of ideas and comments I've received from other individuals. And it's all about just our proposal to say, hey, you know what, as a board, we feel Utah patients could best be served by having a mechanism in which they can find these products, as I outlined in multiple times. So.
And I don't think you've heard anyone disagree with that.
Mhm.
But our board in the past has made very specific recommendations to take very specific actions, to say that we should just continue to study something that has, as you've heard here today, some very significant questions around it. I don't think anyone here, I'll only speak for myself, but I don't think anyone here is saying patients don't deserve this information. You've heard many people say this information is already available. So I think to make kind of an amorphous, squishy recommendation that the legislature continue to do the studying that they're doing, that's what's already happening. I don't think we have enough information as a board to make a real recommendation like we have in the past. This, to me, would be departing from the types of recommendations that we made in the past. For instance, when we recommended additional form factors, we went so far as to go all the way to a very specific definition of what that form factor was going to be. All of our recommendations have been specific. This seems just super general. And if lawmakers need this board to give them a generalized recommendation, I don't think this board is serving its purpose. So I would make a motion that we table this until we have further information, until we know what the interpretation is. Someone can give us an interpretation. UDAP's lawyer is going to come next time. We've invited them. That may not be the end all be all answer, but I'm sure it would lend itself. I just don't think this is necessary, given the information we currently have. Do patients deserve to have access to this information? Yes, but a majority of this information is already out there. And I think not knowing what the cost is, not knowing how quickly this will be built out, because if this takes say it takes a year to 2 years to be built out, what are we doing in the interim to make sure we keep patients in the program, to get more patients in the program, to make this program more healthy, to make it so we don't get forced to go for someone to put forth an adult use campaign? How do we continue to combat the black market and other markets in other states? Waiting on a website that, while may have some laudable goals around it, I just at this point think it's premature.
What guarantee does it have that it will save patients money?
Well, I mean, at the end, none of the programs we implement or things we've recommended as a board have been guaranteed to save patients money.
Seems like a big gamble, though.
But well, all I'm saying is I understand tabling it. This is an agenda item for pricing transparency, but this is on today's meeting for the governance group. So, I mean, if we're wanting to table this topic, I'm happy to do that. We can wait for further information. To table it because we want processors to have the ability to website, that's not the right, I feel, is the right mechanism. These are separate things, because they're, I mean, and so I don't want to beat a dead horse as far as why a processor website won't help with patient access to products. But I think this is a separate thing. And then as we go to the governance board and as they have their meeting today on what their priorities and what they feel to recommend, and we can get clarifying information from them, we can definitely bring this back in a future agenda item to discuss it at length if necessary. And we'll invite those individuals that are privy to that, how they're looking to propose this rule change. So, I mean, with that, I'm happy. I mean, if everyone is at the same consensus, to table it, I'm happy to make a motion to table the statewide inventory website for a future meeting. Okay, it's been seconded. All right, Abby, do you want to take a roll call vote? No, it was Cammie.
Yes.
Nanette Perez,
Yes.
Amy Clark,
Yes.
Desiree Hennessy,
Yes.
Katie Gregson,
Yes.
Chris Morgan,
Yes.
Matthew Page,
Yes.
Misty Smith.
Yes.
We will move on to the next meeting. We do have time, so we will get into our next meeting's agenda. I know, as of right now, looking at what the medical cannabis governance group is working on, there's several items, and I don't know, I'll just kind of list them. But let's see here. I was just to pull up the agenda. I can find it, my email. And then for those of you who don't know, this is on the medical or the public meeting notice for the medical governance group. Let's see, so some of the items, and so potentially these will be on some stuff we'll be discussing. And I know Rich did mention it because they were presenting today. It's talking about medical cannabis education, the medical cannabis application process, the medical cannabis recommendation process, medical cannabis in primary care, and then medical cannabis affordability, medical cannabis pharmacy licensing, the general session related items, and then medical cannabis price transparency. So they have a very full agenda of 9 items. So I'm fairly certain as we get into what they're discussing, there will be several items from that we will be taking away to discuss here and present. And so if you are able to attend that meeting as a virtually, I do recommend. It's always good to kind of get further information on the state of medical cannabis in Utah and what direction they're taking. So, okay, is there anything that you guys would like to see on a future agenda? We can want to talk here today, if not.
I think at some point, I know that obviously the DEA is gonna host their, hearing on rescheduling. I would still like to get back and understand what each board member and how their work within the cannabis space, whether as a patient, whether as a researcher, whether as a QMP, whether as a pharmacy, owner, or as a producer, how that's going to impact all of us, because Blake spoke to some things today, and I'll just say this. If cannabis is rescheduled and treated like all other Schedule III substances, this all goes up in smoke, folks. It just does. And so we really should be talking about that conversation, because and either that or if you're forced to go adult use and then continue to operate outside the bounds of federal law, because as we exist today, rescheduling will still keep us as federal criminals. So we really need to make sure that we're paying attention to that and making sure Utah can do the best it can to be prepared for that. Because when the legislature gave its presentation, my own words, I still think ring true. They told half the story. And I really do think I would like to see that on the agenda at some point. So if not next month, maybe in the month of January after the DEA.
I think it's December 2nd. Is that when they're the proposed meeting? So, yeah, I'll make sure for our next meeting for just our business section, I'll try to get that information out to the board so you have the opportunity to listen to that meeting. It definitely will impact our role here and the role of medical cannabis for Utah, regardless of the decision they make. I mean, it could be this. They do nothing. It could be completely different. So, is there anything else anyone else would like to get added or discuss? If not, I mean, please reach out to myself or Desiree, Trevor, as well as we do have our strategy meeting this Thursday to discuss our future agendas. And just for your understanding, if there is an issue or anything that you want to get addressed and we don't hear by Thursday, please reach out at any time. I mean, we have plenty of time to get information added to the agendas. We need at least a week notice for our bylaws. So I don't want that. Oh, I missed the strategy meeting. Now I got to hold off a month and a half just because of that. So I want to make sure what's important to you and in your roles and in your scope of responsibility is heard at this board. So that way we can take this medical cannabis in a good direction. So with that, I will go ahead and take the final motion for the day.
Motion to adjourn.
Second.
All right, and that is approved unanimously. All right, thank you very much, everyone.
Thank you.